Hi everyone, my name is Lanie Corrado and today I'm going to be doing a drug overview for Ativan. So what is it? Ativan, or the generic name of lorazepam, is in the drug class of benzodiazepines. This is widely prescribed as a treatment for anxiety, symptoms, insomnia, and in some cases epilepsy. According to a Drug Enforcement Administration, or the DEA, report from 2011, over 27 million prescriptions were written for lorazepam alone. Benzodiazepines are central nervous system depressants. They work by acting on the neurotransmitter gamma-aminobutyric acid, or GABA. GABA is a major inhibitory neurotransmitter in the brain. And so what it means by benzodiazepine enhancing the effects is there's a greater inhibitory reaction or a decrease in activity in the brain. In really basic terms, it produces a sort of calming effect for the body. According to the DEA, benzodiazepines are a Schedule IV depressant under the Controlled Substance Act, meaning they are regulated by prescription and have FDA-approved medical usage. Benzodiazepines were initially discovered by Dr. Leo Sternbach on accident in 1954, when what was deemed as a failed experiment turned out to be effective in its desired inhibitory effects. Ativan initially was discovered for the use of an anti-anxiety medication and was later introduced and approved by the FDA in 1977. Though the chemical structure has not changed, dosage, production methods, and effective use for more applications have advanced along with technology. As a psychiatric nursing assistant, I often see the use of Ativan in psychiatric hospitals. It's most commonly used as a PRN, which stands for the Latin phrase pro re nata, meaning when necessary. Oftentimes it's used for anxiety attacks when they feel they're coming on. And as Ativan is a depressant, it helps calm the anxiety with the inhibitory effects of the GABA enhancement. Even after discharge from a hospital or higher level of care, Ativan is still prescribed with the goal to have it be taken on an as-needed basis, with the discontinuation of use resulting in initial sleep abnormalities and increased anxiety, but it's usually combated with coping skills and time for the body to reset. Like any other prescribed substance, there is the possibility for misuse. Some of this is found in long-term use, where tolerance can be often developed. This results in the need for higher doses of Ativan to elicit the desired calming effect. It is in long-term use that dependence can occur, either physically, where the body cannot function properly without the administration of the drug, or psychologically, where the individual convinces himself that they cannot function without the drug. Something that can be found in long-term use or overuse is addiction, and this can occur even in those who are taking it prescriptionally. But often substance misuse, abuse, or use disorder, as identified by taking the drug without prescription, taking it to get high, taking it at higher doses or frequencies than prescribed, or mixing it with other substances. Often we see this misuse or abuse in populations of adolescents who are searching for the high feeling, and as it is commonly prescribed, they have easy access to it. It can also be concerning for those with suicidal ideation or tendencies to take without being held accountable in some way. If Ativan is mixed with other substances or an overdose occurs, this therapeutic drug does become lethal. From the 27 million prescriptions that were written, over 50,000 people were admitted to the hospital with use or abuse of Ativan alone. Addiction and dependence can also result in withdrawal symptoms. These could include insomnia, nausea or vomiting, tachycardia or increased heart rate, increased anxiety, convulsions, or seizures. Because of the intense withdrawal and side effects that come from overuse and the therapeutic intention of the drug, under no circumstance would I recommend taking this drug recreationally. First, all the adverse effects of the drug are unknown. In fact, it has been in the last decade or two that it was discovered that the assumption that lorazepam did not affect memory was false, and cases of amnesia have been directly linked to diazepam misuse. Second, research has demonstrated that the majority of those who start by taking Ativan as a simple sedative or as a downer end up mixing it with other substances, resulting in permanent or irreversible central nervous system damage. And third, according to the DEA, it is one of the top 3 drugs that have diverted from the illicit market. This means that for one to get their hands on this for recreational use, it's first and foremost illegal, and is often done by receiving false or forging prescriptions, which is another illicit offense. Ultimately, lorazepam is effective in controlled and proper dosage to treat and help to alleviate the symptoms and conditions such as anxiety, insomnia, and epilepsy. In taking Ativan, make sure you follow the recommended dosage. Keep the medication locked up someplace safe that those who want to use it for recreational usage or lethal purposes can't abuse it. And if you experience any of the symptoms or warning signs on the label, make sure you call your doctor immediately. I hope this video shared some valuable information about what Ativan is and if it's right for you. Thank you so much.